area. I'm doing a little lecture on ADD and ADHD, talking about some of the ways that you can look at it, do some tests, and some of the treatment options for people out there. It's very annoying, very frustrating if you have a child that has ADD, ADHD, and I love to help. So this lecture is talking about some of the differences between the medical approach and more alternative approaches. I just wanted to touch on some of the medical approaches. How do you test for it? What are some of the treatment things for it? And we'll just look into that, some of the pros and cons. When I was researching how the testing is done, I was a little surprised. If you have a child that is just, compared to other children, all over the place, can't sit still, screaming, upset, angry, can't focus, can't do tasks, all those things, the symptoms of ADD or ADHD, you know it. So if you go to the medical doctor, what they're going to do to test to see if he has it is do a survey. Does he have this or this or this? And then they're going to go, yep, okay, he has ADHD. Well, you knew that. ADHD just means it has a collection of these symptoms. So they might ask the teachers, they might ask you, they might observe in the office and just kind of tally up the survey. So there's no test that's done. There's no blood test, there's no urine test. I was a little surprised. So if you get this diagnosis on yourself as an adult or on a child, then you've got this diagnosis, and then what's going to happen? Diagnosis, you rotate, and then you start going for a prescription drug that's going to be used to help alleviate the symptoms of the ADHD. So just looked up what some of the drugs are. It seems like the drugs of choice for this is going to be Dexedrine, Strattera, Focalin, Vyvanse, Concerta, or maybe Ritalin. Ritalin's the one that I hear about the most, and it's kind of you just hear that word talked about some. So that's cool, right? Not so much, because the side effects to any prescription drug are not what you want. The side effects to these collection of drugs, 60% of kids have weight loss, not weight loss, sorry, appetite loss. And then when you have a loss of appetite, you either have a slowing of growth or you have weight loss. So 60% of kids have loss of appetite. That's too high in my opinion. Let me just read some of these other symptoms. Loss of appetite, sleep problems, mood swings, mood disturbances, nausea, GI problems, weight loss, anxiety gets worse, which seems weird because kind of that, I think of ADD, ADHD as being slightly anxious, can't sit still, a little bit nervous maybe. And then if these drugs are making the nervousness worse, that seems counterproductive. Are they supposed to calm them down? Exacerbation of anxiety, irritable, headaches, and again, as I mentioned, loss of appetite in about 60% of the kids who get on these drugs. And it seems like it's like, here's this drug, see you later, come back in a few years. This might be something that you need for life. It's frustrating because I don't see that there is testing being done for what's behind the ADHD or ADD. I'm big into let's find out what's causing this. I am not so impressed or care too much what the label is that's put on this condition. Yes, it's a condition, but I'm interested to know what's the problem with the body. You have symptoms from the brain making a child or an adult overactive, trouble focusing. So it's a brain problem. Think of it more like a brain symptom. There's something going on somewhere else that is causing the brain to be reactive. So there's some inflammation in the brain. There's some irritability in the brain. We want to find out what is making the brain irritable. So there's a bunch of tests that can be run to try to find out irritants, what's going on that could cause the brain to be irritable. Let's run those tests and figure it out. But that's not done with the standard approach. So that's the weakness there. And the side effects to the drugs. So I'm going to get into the next lecture talking about what some of the tests can be done that pick up on what the irritation is on the brain. So if you work on what's the irritation, then the brain starts to calm down from my experience, and you see kids, adults blossom, brain activity starts getting more manageable, calming down, staying on focus, happier, sleeping better, all sorts of nice things. So next lecture I'll be talking about what those things are. So hope to see you on the next lecture. If you have some questions, please ask me questions. I'll do my best to answer a question, or I'll make a video about something if you have a good question about a new health topic. Let's do some videos and get some of the good news out about natural medicine and some alternative approaches to common health problems. ADD and ADHD is very, very frustrating. So this is Dr. Cohn, over and out. I'll see you on the next video.